So, hi everyone. Welcome to this session. For some reason, I guess maybe this is Friday. There are not many people, but we will be sharing the recording in any case. So, this is the first technical session. Very quickly, Muskan, a participant, Samuel Adukola, is trying to find the link. Can you send him the email? He's uh, he sent you an email as well. So today we are going to be discussing the foundations of supply chain, which includes two key topics. One is human resources, and the other is supply chain costs. Now, as we discussed um, in the last session, that supply chain enablers are equally important to be understood by all of you as health or supply chain professionals, because many times the issues lies uh, in the enablers rather than in your core technical functions. And because we are not able to solve these issues, uh, our core technical functions, they suffer. So today we are going to be looking into some of these issues and how some um, methods can be used. But of course, see, this is a learning environment. Um, some of these things, they work in a different way in different countries, and also in Nigeria as well. With different states, there can be different, means or different causes or different ways of solving a problem. So these are some methods that you can use and adapt to your needs. Okay. So today, like I said, we will discuss HR requirements in supply chain, competency frameworks, what are they, and how they can help you. And we will also try to understand supply chain costs. So very quickly. Now, all of you who have done CLC1, you may have seen this and may remember this framework. This is the overall supply chain framework. And in this course, in CLC2, we are focusing on the first of all on the foundations, which is the base layer. So if you see where the green arrow is, and in this base layer, in the foundation, lies supply chain, workforce, human resources. So human resources are the backbone of any supply chain operation. Without human resources, no supply chain will work. Okay, I mean, maybe a few years down the line, a lot of the work will be done by AI and robots or whatever, but at least not today. So today, if we don't have the right human resources, then we will struggle. So as you see, what is written, for a supply chain to be effective and efficient, we need adequate human resources. We need appropriately skilled human resources. We need them to be motivated, and we need the right working conditions for them. If any of these four, there is an issue, then human resources will struggle and eventually the system will struggle, which in this case is your health supply chains. Now, in this slide, let's see why many countries struggle to find the right human resources. Okay. Um, the other day we were having this discussion with Madam Batur that in her state they don't have budgets to find the right person. They're always at budget cuts, so a lot of these people are overworked, etc., etc. Okay, so this is not a rare problem. This is a very common problem, and it happens everywhere. But even uh, the bigger issue is not having finance, because finance eventually can be found. Money can be found from various sources. The bigger issue is a lot of times organizations, first of all, do not know how many human resources that they need for their supply chain operations. Supply chain operations in any state in Nigeria is a multi-tiered operation. So you, first of all, there is a federal level, then there is a state level. Even at a state level, you have a DMA, you have an LMCU, and then beyond state, in some states which are larger, you may have a sort of a sub state structure, and then you will have your local government areas. In some states, you directly may have local government areas. So it has a multi-tiered operation. So at every tier, you need someone who is focusing on supply chain. But do you know how many are needed? Do you know what functions exactly can be categorized as supply chain? And that is where the problem is. So if you don't know how many are needed, how will you budget for them? That is a big issue. And again, the second point is the same. So once you know, if say you know how many you need, how will you finance those positions? Will that financing be sustainable for a long period of time? That is a constant struggle. Then let's assume that, okay, now that in many states you have created DMAs and you have created NMCUs, and they have the adequate staff. Do you think they have the right skills? Now that is another question. A lot of time organizations don't know what skills are needed in those departments for supply chain professionals. And that is a very core issue, not just in Nigeria, but in several African countries. Then a lot of times, maybe all of this is okay. They also know what skills are needed, but then there are some legal contractual issues. In a lot of countries, and I don't know what is the situation right now in Nigeria, a lot of governments cannot find these professionals because these job roles are not written in their national human resources structure. In a lot of countries, supply chain professional does not even exist within the Ministry of Health structure. So they have to create, external contracts, and those contracts are generally 1 year contract, 2 year contracts. And you will see that most people do not want small um, positions for small duration. We're looking for longer duration contracts. So that is an issue. And then eventually what happens, a lot of these professionals who are skilled, the health system, the public sector loses into the private sector. And once they enter the private sector, a very few come back because private sector gives them better, better salaries, better working conditions, a lot of the things. Okay, so this is important for any organization to understand, as much as it is important to understand from the perspective of a supply chain professional who is aiming to become a manager or a leader in their respective institution. That without the right human resource, your supply chain operation will struggle. So, what are some of the solutions? So today, we're going to talk about one of the solutions which can help you understand what are the right skills that are needed for supply chain, and how can you continuously improve on those skills as an organization. Today, we are going to talk about competency frameworks. So uh, this was a basic context which I wanted to give you before I introduced competency frameworks. Before we talk about the framework, first let's understand what is a competency. You may have heard about it many times. Uh, and a lot of times competencies are used interchangeably with skills. Okay, but competency is a mixture of skills, knowledge, skills, and behavior, or knowledge, skills, and attributes. It's all of it together. It's not just skills, or not just knowledge, or not just abilities, attributes, or behaviors. It's a mixture of that. So if we read the correct definition, which is on your screen, it says a competency is the capability, apply or use a set of related knowledge, skills, and abilities required to successfully perform critical work functions. Okay, so now critical work functions in a supply chain context would be, for example, preparing a supply plan, for example, or creating an RFP, request for proposal, or an invitation to bid, or creating a contract, or negotiating with the supplier, or For example, working on ELMIS or creating forecasts. So these are all skills along with the knowledge to do them and along with the right behaviors. All that combined becomes a competency. So then a competency framework is a model that broadly describes performance excellence within an organization. So competency framework, what it does, it categorizes these different competencies into a structure that eventually defines how a particular activity should be organized, what are the performance excellence within that activity, and then to successfully do that activity, what kind of knowledge, skills, and behaviors are needed. Okay. Now, this kind of a framework can really help institutions, number one, understand what kind of skills are needed in their organization, depending on their functions or responsibility of that organization. So, for example, for any state DMA, a competency framework specific to supply chain in their context can help them understand what are the skills that they need as a DMA to run supply chain of a state. Okay, and then it will also tell them um, how to continuously upgrade that skill. That is an application of a competency framework. So using that framework, they can recruit the right people, people who have those skills, and they can continuously help them upgrade their skills as well. Because a competency framework can also be designed as per the hierarchy of an organization. And then let's see an example from Ethiopia. Okay, first of all, let's see applications and then we will see an example. So a competency framework can have multiple applications. So one, it can be used to derive or develop a training plan. To do that, a competency-based training needs analysis can be done, and that will lead to a training plan. Then staffing models can be designed. So for staffing models mean that, for example, at DMA, how many staff are needed in which roles. So that is a staffing model. And similarly, beyond below DMA at LNCU level, what kind of staffing is needed for what level, for what role, all that stuff. Then performance management system, because competency framework also tells you that okay, for a specific task, what is the correct output, and for that, what kind of skills are needed. So if you know the output of that particular task, and if some of your staff are not measuring up to that, then that becomes a performance issue. Then competency frameworks can also be used to create job description and hence aid in the recruitment process. And finally, succession planning criteria. So, for example, for leaders, a competency framework can help them identify the competencies that are required at a leadership role. And and as a leader is going out, they can work with that leader, identify the key competencies required for that role, and then help someone develop that even before the leader, goes out. So there should be a transition. Okay, so these can be various applications of a competency framework. In many countries now, for supply chain, this is being used. In Nigeria, don't think so. Maybe someone is doing ad hoc, but ideally, in a country like Nigeria, first of all, there should be a national competency framework for supply chain, and then that could be adapted by every state to do all this, which I'm showing you on the screen. And that makes it very standardized. That makes it a professionalized approach for human resources in supply chain. So let's look at an example from Ethiopia. So, okay, this I will come very quickly, but let's look at an example from Ethiopia. So this is the work that I personally did in Ethiopia with the Ethiopian Pharmaceutical Supplies Agency, or today called Ethiopian Pharmaceutical Supply Services. This organization, now unlike Nigeria, Ethiopia does not have a decentralized structure. They have a centralized structure. So they only have one supply chain organization who manages supply chain of medical products throughout the country. and it is called Ethiopian Pharmaceutical Supply Services. They have about 2,000 people, more or less, let's say. It keeps on changing here and there every year. But they have about 2,000 people across the entire country. So because they have a head office, then they have about 18 regional centers, and then some staff are also embedded with their. So, for example, like you call local government areas, they call it a Voreda. So some staff are embedded with Voreda to help them as well. So in total, they have about 2,000. So it took us about 1.5 years, but we mapped all the work that IPSA does, EPSA, uh, and compared it against an internationally developed competency framework by people that deliver. And we realized that IPSA's work can be categorized first of all into four segments. And as per that segment, we can create different competency statements. So if you see here, those four segments were supply chain technical. So for example, quantification, procurement, warehousing. Then their corporate or administrative structures, human resources, finance, management information, etc., etc. Then leadership and management, the top one, which says management, and then at the bottom, which says foundational. So what are the basic behavioral skills that are needed by everyone? Okay, so we mapped it out in this way, and then each box had a list of competencies which IPSA staff would need, defined as per their job hierarchy. So let's look at the next slide. So IPSA, uh, we mapped their entire job hierarchy into four levels. So they had about 9 job bands within the organization, a total of 9. So we mapped those 9 into these four boxes. So two of those roles came as introductory, which is like a starting professional. Then three of them came at essential, which are like one level up, like a supervisor, basic supervisor. Then two more came at advanced, three more rather. So 3 to 5, 2 7. Yeah, two more in advanced, which are like managers and team leaders and managers. And finally, they had a deputy director general and a director general, and yeah, deputy director general and director general, which is like at the helm. So the strategic. Okay. So we mapped all those roles across these four levels. And then within these four levels, we wrote which competencies are needed per these boxes, the four, technical boxes. So now we know. So what happened after we did all that exercise? So now we know that if someone is working in IPSA at the introductory level, the initial two job bands, we know what skills they need in the department that they're working in. So IPSA can invest first of all, IPSA can recruit the people who have those basic skills, and then they can invest in training on those skills for those staff so that they go from introductory to essential. And similarly, same who are working on the number two job band, they can be recruited in a way that IPSA knows that basic skills are there, and then they invest on them with training so that they can go from job band 2 to job band 3. Okay, and then on the number 4 job band, there is succession planning, so that we know that okay, these are the leaders and they require these competencies. So if they have to do succession planning, everyone, whoever is working at that level and is supposed to be succeeding the outgoing person, they should also have these kind of skills. So this helps the entire organization create a job framework, create a skills framework, so that everyone knows what kind of training they should go to, what kind of skills they should have, and hence link to all those skills the activities that they are responsible for. So this is a very structured, systematic way of managing a supply chain organization or managing human resources in supply chain. And this is what is being talked about globally by an organization called People That Deliver, who recently with the ARC ESM, I'm sure you know ARC ESM, ARC excellence for supply chain management in Nigeria. So with our ESM and people that deliver, they worked with the federal government and some of the state governments, and they created a structure for professionalization of supply chain in Nigeria. And part of it was this, that eventually, once they start implementing some of it, there should be some sort of a competency based system of human resources in Nigeria, which is very similar to this work in Ethiopia. So similarly, I have done similar works in other countries, which are very similar, and in other domains as well. So not just supply chain, but also in regulatory. I've done very similar things, and what we have been able to show that when these competencies are defined, people are more motivated because they know where they are going, what is their career journey, you know, and that makes them more motivated and they do better work. Even this particular course, the one that you are on, the foundation of this course are the competencies which were written by people that deliver at a global level. So we took those competencies for the supply chain enabling functions and adapted them and then created the course out of it. So that whatever you are learning is as per accepted global standards. So all this is linked to competencies, and hence, as a supply chain professional, you must be aware of what are the core competencies at each level required in supply chain, whether they are for technical functions or for enabling functions. Okay. Um, so yeah, okay. Before we end this section, let me also show you this slide. Now, if you see here, this is what I was saying. How can a competency framework help in career progression? So if you see a competency, say manage supply planning. So if you're managing supply planning, now a competency framework can help you understand what each role should do and then what kind of skills are needed there. If you see understanding basic requirements to evaluating policies, different type of activities which different types of people do as per their levels, and hence the kind of skills they need to be able to do that. And this is what a competency framework helps you do. So you have these slides. Please go through them, and you will have a slightly better idea. Again, we don't expect you to become an expert in creating competency frameworks or analyzing competency frameworks. Our objective here is that as a supply chain professional, you should know that a better way of managing human resources starts if you start with a dialogue on professionalization. And one of the key components when we try to professionalize supply chain is to look into the competencies in a systematic way. That means having a competency framework, organizing training needs analysis as per competencies, creating training plans, and recruitment systems. That is what you should know as supply chain professionals, and that is what you should advocate in your organization or in the sector. Okay. Now, at this point, if you have any questions, uh, I'm happy to answer. After that, we'll do a quick activity. Any questions? You can also type your question in the chat. I see some people's internet may not be that good, so they are coming and going. But that's okay. The video will anyways be shared. Okay. So if there are no questions, let's do this activity very quickly. And we will do this in plenary because we don't have many people. Um, I have mentioned 3 points here, and I want to ask all of you as to how do you think a competency framework can be used in Nigeria? Think from the perspective of recruitment, skill development, and performance management system. So if you have any existing experience, or if you can, you know, tell us what do you think? How can a competency framework be used in Nigeria in one of these in one of these processes like recruitment, skill development, or performance management? Anyone is okay to contribute, but please contribute so that we know from your perspective as well. Anyone? Yes, Festus, please, you can speak. Yeah, Festus, can you hear me? You can speak. Festus, you're muted.
Okay, can you hear me now?
Yeah, I can.
Okay, so I said I want to speak on the performance management system.
Hmm.
My idea is in developing this competency framework is to have a key and have key performance indicators at various levels of work, which you are supposed to be monitoring or checking to see whether at that level those indicators are actually met, and the indicators are supposed to be graded from the lower level to the upper level or to the managerial or leadership role, depending on what each person is doing. There are specific things that are supposed to be monitored or should be checked within there. I don't know whether I'm right or not.
Okay, let me summarize what you have said, because it may not have been audible to everyone. What Festus said, that he wants to use the system of competency framework for performance management system in a way where he can create various key performance indicators, KPIs, on different tasks, and also link them with the skills that are needed to perform those tasks. So if someone is getting trained, uh, they must be able to show and demonstrate those key performance indicators and carry out those activities. If they don't, then there should be some sort of a management action. Festus, I hope I have summarized what you said properly.
Very well, very well, very well.
Excellent. So thanks, Festus. I think that's great. This is a great methodology, and I can tell you this is a very scientific methodology as well. There are multiple research and papers on how to do it. Festus, if you go back and read about it, you will find that what you thought is absolutely correct, and it can be done. Yes, there will be some pushback because anytime you bring something new, people will push back. But this is a really good way to go and improve your supply chain performance. So, great idea. Anyone else who would like to speak and talk about how you think competency frameworks can be applied in these three things or anything else that you can think of? The floor is open, and whatever you say will be helpful, and I will always try to support you and add more things. Uh, because if you speak, it will not only help you, it will help everyone in the group. So the floor is still open. Yeah, Blessing,
Okay,
you want to
good
speak?
afternoon. Yes,
Good
I would like to
afternoon.
speak. Yes, thank you. I would like to speak on the recruitment process.
Hmm.
Having a competency framework allows recruiters to know the exact skill sets that they are looking for when they are
Hmm.
trying to employ people. Um, Maybe supply chain managers. And
Hmm.
also, it helps we as the professionals to better equip ourselves when we are applying for job roles because we know exactly what the recruiters are looking for. Thank you.
Indeed. So let's take a scenario. Let's say in the next couple of years, there is a national competency framework uh, for health supply chain for Nigeria. And it lists down all the various skills that a supply chain professional should have and maybe also segregated by various levels. Because, say if you are up to 5 years of experience, to 10 years of experience, 15, 20 years of experience, again, hypothetically speaking. So now, as an individual, whichever band that you may fall, so say you are an individual with about 5 years of experience, you open the competency framework and it says that you should have A, B, C, D, E, F skills. And you know that, oh, you only have 3 out of 6. So then you, as an individual, knows that you need to work on 3 more skills if you really want to be successful in this sector. So when a recruiter creates the job description for a position, they will write those 6 skills. If you only have 3, then you know your chances of getting that position is low. But if you have 6 and maybe more, then you know that your chances of getting that job is much higher. And then you can demonstrate those skills as well based on your past experience, based on your education, etc., etc. So that is how competency frameworks can be used by an individual, by a recruiter, and by an organization. Yeah. Um, Again, anyone else who would want to add more? There's two very good submissions. So anyone who would want to talk more about the same or anything else that you can think of? Yes, Isaac.
Hello, good afternoon.
Good afternoon.
Thank you very much. Even though the network is poor, I can hear some of the things. Now, you've raised several issues about supply chain competency, and we appreciate the things we have learned in the cohort 1, and this 2 is looking more and more, we are going more and more deeper. Do you have, like you said, from some of the videos, the supply chain functions are being carried out by doctors, nurses, pharmacists, lab scientists, and the likes. And the challenge is that it's not part of the curriculum. It's of recent now in pharmacy school, supply chain is being added. So, but like this training and certification, are there other trainings that the skill does to make one more competent in the supply chain function, so that, for example, when they are looking for competency, if someone presents this certification, it will give the person a better advantage as someone who has learned on the job, since on the job training is required. Even though as pharmacists, we have some experience, but it's on the job too. But are there competency training apart from this cohort 1 and 2 that we are going through? Thank you very much.
Okay. Isaac has turned this discussion into a real career question. So thanks, Isaac. Isaac, very relevant question. And if you can please mute yourself, there is a background noise coming from your side. If you have to contribute again, then you can unmute yourself again. So very relevant question, and I think it applies to everyone who's here. Now, first things first, most of the pharmacy curriculum, they do not have they don't have supply chain competencies embedded into it, because they mostly focus on what is initially a pharmacist should do. But things have changed. Pharmacists are not only involved in product dispensing and patient support, but they are more and more involved in managing the supply of drugs. But those competencies are not properly, systematically included in the curriculum, and that is a fact. Now, to address that issue, the government of Nigeria they have, so government of Nigeria at a federal level, they have acknowledged this gap. There is a study of from a couple of years ago. We can send it to you as well. So they have acknowledged this gap, and they have instructed several universities in the country to create master's level curriculum on supply chain. So they've acknowledged that there is a gap, but they did not say that the pharmacy curriculum should be modified. That is an issue. So ideally, they should have said that pharmacy curriculum should have been modified or should be modified by maybe adding elective modules. So even if you don't change the curriculum, just add an elective on top. If someone really wants to know supply chain, they can go and learn it. Number one. So master curriculum, master's level degrees are available now with some universities, but that is a master's level degree, which some of you who are working professionals may not always be able to do. Okay. Hence, there is a requirement of courses like these that you are doing today, which are more for working professionals, which are more like a continuous professional development courses. So yes, there are courses that we are building specifically for pharmacists, specifically for nurses, specifically for lab scientists who are all involved in supply chains. These are just the beginning. So these two courses, CLC1 and CLC2, this sets a base for you to go and start understanding supply chain systematically and start doing some of the functions. From now, you will see by the end of this year, we are launching a specialized course in forecasting and supply planning, which is a core issue in many, many supply chains. Next year, we will be launching a course on warehousing inventory management. So, warehousing large warehouses and inventory management at any particular store, pharmacy, um, or a hospital or a clinic. So it will be applicable to everyone, not just public health professionals. It will be applicable to health professionals and pharmacists. Okay. Then the other course in the pipeline is financing. So using a drug revolving fund model, RDF, revolving drug fund model, which is also applicable in Nigeria. That is under development. So all these courses are very carefully selected for, and then there are more. I have not talked about it, but there are more. There are a few more which are under the development process. So we have this process where we check the competencies which are needed, then we write the content as per those competency, then that is reviewed by experts, first of all industry experts, then they are turned into these courses that you see on the site with varying multimedia videos, this and that. So that takes a bit of time, and then they're accredited by our agency with whom we are associated with. It's a process, and hence it takes a bit of time. But yes, we have multiple courses coming up which are very specific to pharmacists, which are very specifically looking into the competencies needed by pharmacists, nurses, and other health professionals who are working in supply chains, so that you don't have to go back to school. You can get these competencies right now, even if you did not study them. But I think as professionals, you also must advocate for universities to include these competencies as part of existing curriculum, even if they can't do it in the current structure. They can create elective modules that students can go through. Okay. So to answer your question, Isaac, uh, Isaac, right? Yeah. Yes, there are more courses. These are just the beginning. So keep coming back to Hive and keep checking your emails. We will be informing you of other courses that are being launched. In fact, we are working with a university from the UK, Liverpool School of Tropical Medicine, and we will also bring courses on pharmaceutical management very soon. So all that is happening while we are doing CLC1. So CLC1 and CLC2, it sets the base, and then you can go deeper into different functions that, for example, if someone is more um, involved in forecasting, so they should do the forecasting course. If someone is more involved in warehousing or inventory management, they should do that one. So, those kind of things. Okay, let's take another comment. After acquiring this supply chain skill, how can I get a place that, how can I get a place that? Sorry, Farm Hafsat, I could not understand your question. Can you speak and ask the question again? The floor is all yours.
Good afternoon. Good evening. Sorry.
Good afternoon. Yeah.
I'm just asking, like, I am aspiring supply chain manager. So
Mhm,
I want to start with this. I'm starting with this course actually, though I've done a UNDP program earlier.
mhm,
So for me to have a practical experience of like a warehouse, how do I
mhm.
get, because I know I have some mentors on the platform. How do somebody get to have a practical experience in a warehouse or any place that I can apply such knowledge that I've acquired? That's my question.
Okay, that's a valid one. Now, see, it is uh, all it not every time it is possible, but sometimes we are looking for some partnerships where we can send some of our students to see what's happening in the real life, because there is no substitute for real life experience. Uh, the other thing that has also happened with some of our past learners and certified students is that they have used these certifications to apply for supply chain jobs, and many of them have got it as well. I have written testaments from at least three of them, one from Rwanda, one from Ghana, and the other is from a French country, I think Benin. So they did these courses and they showed this as core skills, and one of them got a job with Chemonics, one of them got a job with the Central Medical Store. So people have gotten jobs using these courses as well, showing as supply chain education. So it may still work in your countries as well if you have some bachelor's and master's degree. So you can still show them these courses as well, your CPD certification that you have these skills, and then find jobs depending on your interest. But of course, if you're only looking for basic experience, then I would suggest that you find out, uh, your nearest medical product store. So, for example, your DMA would have one, and then write to them as a fellow professional and as a student that you're doing this course and you want to visit. And you may have to follow up a few times because sometimes in government agencies it takes a bit of time, but if you are also part of the system, then and you're doing a course, I think someone will help you in seeing the system live and then getting more understanding. So eventually, it's totally up to you. If you want a job, use them as a proper supply chain education as well. Uh, I know some people have gotten jobs. You can as well. And if you want recommendations, we provide recommendations as well. You have a network as well now, so all these people are your kind of fellows and colleagues. You take their help, you ask them, and I'm sure one way or the other you will be you will be able to find uh, a right job or a right way to gain more experience in supply chain. So that is what I can say at this point. We are still looking for bigger projects in Nigeria. So once we start working on bigger projects in Nigeria, that's when we can also start to engage our learners, certified learners. We do it other countries. We have done it in Madagascar. We have done it in Sierra Leone. So when we do bigger projects, we first go to our learners, certified ones, that okay, we're doing this. If someone has these skills, please raise your hand, and then we will see if we can work with them. That also happens. So lots of options, but you have to take some initiative, and then whatever direction that you want to go, we can help you to some point. But again, the initiative has to be taken by you. Okay. So thank you. So let's move forward. Let's move to the second section today. I know it's a Friday and you all have to go home as well. The second part of the question, now it's on the totally slightly different part than human resources. This is about financing and costs. Now, as much as human resources are important in supply chain, financing is equally important, and hence it is at the base, the foundation of any supply chain. Without funds, without money, your supply chains will stop working. It is as simple as that. Even without money, human resources won't be there. Now we need to pay human resources, so without funds, everything stops. So for a better financing of supply chain, the first prerequisite is to understand the costs. And we generally don't do that. In many health supply chains, we don't know the cost of running the supply chain. We don't even know the answer to this basic question which is written on the screen. So just let's read it. Do you know how much does it cost to deliver a pack, a secondary pack, say 100 tablets or whatever is the pack size of isoniazid or paracetamol or ibuprofen or cefixime or amoxicillin, any pack of these essential products from anywhere in the world to your health facility? Do you know the cost of that? The cost of delivering a pack of medicine to the health facility. I'm very sure none of us know about this. Is there anyone who knows that cost in this group? If anyone knows a basic cost of delivering a pack of medicine to a health facility or a pharmacy, please raise your hands. Yeah. So that's the reality. We don't know what it costs. And you must have heard this phrase in your life that what gets measured gets managed. So if we don't know the cost, how will we manage our supply chains? How will we manage the financing of supply chains? So as a supply chain professional, the first thing you must understand is that you must know the cost of running your supply chains. So, which means more or less knowing these things. Supply chain costs as a percentage of the total value of commodities or product. So, for example, um, let's say state of Gombe or River State, they procure uh, hypothetically they procure $1 million of medical products every year. Okay, so $1 million worth of medical products are distributed by the state every year, in their health facilities, wherever the state health facilities. So out of that $1 million, do they know the, or rather, sorry, do they know the cost of delivering that $1 million of medical products? That would be something, right? Because that includes transportation cost, procurement costs, human resource costs, custom costs if they're applicable, uh, those kind of things. Because the actual cost of commodities is simple. That is what you pay to the manufacturer. But after that, what about all the other costs from getting that product from the manufacturer to your health facility? Who calculates that costs? Because if you know that cost, then you can manage that cost. You can reduce that cost. You can optimize that cost. Okay. Secondly, once you know this as an overall value, then you can also try to calculate the cost per dollar of value or volume or weight, whatever is easier. So per dollar of value means that if you are procuring and delivering $1 worth of medical products, what is the cost of supply chain in all that? So you may find that, okay, to deliver $1 of product from a manufacturer who is based in China or India or South Africa or Bangladesh, you need an average 30 cents. So the total cost becomes 1.3. It's not one then. Then you need $1.3, $1.30. But generally our budgets are made for $1. So every time we have a shortfall of 30. So eventually what we are buying, so we need $1 of medicine, but we are buying 70 cents worth of medicine. So there will be 30% stock out. As simple as that. So if we don't know the cost, we will always make errors in forecasting, in budgeting, in planning. Okay. Third thing, identifying the total supply chain cost as a percentage of total health budget. So every state would have a annual health budget. So budget that government will say, okay, we need this much amount of money to manage health services in the state. Do they know out of that health budget what should be the cost of supply chains, supply chain or managing the supply chain of that health of the health products which are required to deliver the health services? They would not. Okay. So as a supply chain professional, I think when you go back after this session, the first thing that you should reflect on is, do you know the cost of medicines that you manage? Supply chain cost. Of course, you will know the cost of actual medicine, but do you know the cost of supply chain for the medicines that you manage? If you don't, then you should actually panic. Because then the next order of business should be to think how you can figure it out. Okay. So how can you figure it out? Let's see. Okay, where is it going next? Yeah. So I know one state in Nigeria who actually did that. So I'm presenting here. Uh, so uh, very quickly, Muskan, if I'm zooming this, do you also see a zoomed up version, or is it not zoomed up for you?
No, it's not zoomed.
Okay, so can you try to zoom it up from your side? So maybe just take it out from the slideshow mode.
Yeah.
Go to normal slide mode.
Yeah.
And now zoom the slide.
Yeah. Does that work?
Yeah, exactly. So stay here, stay here.
Yeah.
Stay
Okay.
here. So Kaduna State in Nigeria, under the leadership of Madam Ramatu Abdul Qadir, I'm sure a lot of you may have heard of her. She's a very prominent figure in health supply chain or in health services in Nigeria. So she was the head of DMA, I think, at that time. So she commissioned this study with the funding from Bill and Melinda Gates Foundation. And in that state, Muskan, if you can go slightly left. No, sorry, right. Sorry, right. Yeah, that's it. That's it. So we're showing the first figure. So they studied. They did the study of supply chain costs in Kaduna State. So they took a three-tier setup. So tier one, which is DMA. Tier two, I think the bigger facilities and hospitals, and the tier three was your facilities at LGAs. Okay, and they calculated various costs which are included in supply chain. So they realized that there are four types of costs. So one is the procurement cost, storage cost, transport cost, and management cost. Management cost is all the people and all the people related stuff. Everything else, transport, storage, procurement, is your core costs in supply chain. So the first figure is showing that if they are supplying 1,000 naira worth of commodity, what is the cost? Okay. Now, if you scroll left, Muskan. Yeah. Now the second figure is showing the breakup of these costs. So you see here, uh, management costs and storage costs are the highest. So 52% storage cost and 37% management cost. Procurement cost. Now procurement cost in this case is management of procurement, not the actual cost of commodity. Okay. Cost of commodity is different. So procurement cost is the least, and then transport cost is the second number. Low. So second lowest. Then management and then storage. So that means in that state, storage is very expensive. That probably can be reduced, or maybe that depends depending on the quantum of products managed. Now, if you scroll down, Muskan, yeah, on the left, yes. Uh, then on the left, you see tier three cost drivers. I think tier three is the DMA. So you will see at a DMA level. No, I think tier three is facilities. Sorry. Um, no, tier three is DMA. Tier one is facilities. So under tier three, which is DMA, highest cost is management, because over there people are more involved in taking the decisions and doing forecasting, doing procurement. So management cost is higher. Transport costs are also higher at that tier because they don't store much. Whatever comes, they send it out. So that's why transport costs are higher and storage costs are lower. Now, if you go to the image, last one, now this is for facilities. You will see storage costs are higher because products stay for more time at any facility because they have to dispense it. Management costs are significantly less. Transport costs are negligible because they are not transporting it anywhere, they are receiving it. And procurement costs are very few when they are doing any emergency procurement. So all this they have done. So I'm just showing you some basic images. There is a detailed report which you will find in your module. So when you go to your supply chain cost module, the report is there. So it will help you understand the methodology. It will help you understand how did they come at all these costs and what are the different combinations, because costs are different at different levels. So if you go to a health facility, the cost breakup is different. If you go to a tier two, which is a slightly intermediate level, they have a different breakup. At a DMA level, it's a different breakup. Okay. So now when you combine all of this, then you get a full view. That's when you can say, once you have a full view, that what does it cost to deliver one pack from a manufacturer to your health facility. Only then you can arrive when you combine all the three tiers. Okay, and that's they also did it. So once you go to the report, you will find those analyses also being done. I do not know, Muskan, it's fine. We can go back to basic slideshow. I do not know any other state in Nigeria who has done this. I think Gombe tried to do it. I'm not sure whether they published the results. Uh, Kano State, I think also tried. Again, I don't know. I have not seen the results. So some states may have done it. Maybe they have not published the results. Kaduna State has published it properly. There are multiple presentations, journal entry, everything. Okay. So whatever state you are in, you can go back and check if your state has done something like this. If not, I would strongly encourage you guys to look at it, look into it. There is a assignment for you as well for module 2, which is the starting point. But ideally, you should ask the state logistics unit, DMA, if they have done it. If they have not, then you should definitely advocate for it. There are always funds for these kind of studies. There are always donors in the country. Global Fund will support it. Gates Foundation will support it. Some UN organization will support it. It does not require too much of funds any which ways. It may need 4 or 5 people. They can travel in the state for 2 weeks and they can collect all the data, and another 2 to 3 weeks they can analyze all the data. So it's not more than a month long, and then planning maybe another month. So in 2 months you can have this study done for an entire state. Okay, so think about it. Your course has a basic gives you a basic guidance about it and gives you a lot of resources on this, but in practicality, you can go and ask your DMAs and LMCUs about this. And this is definitely something that every state in Nigeria should do. Okay. That takes me to Q&A. So if you have any questions about supply chain costing, please do not hesitate to ask. I'm happy to respond to them as well. And then I will briefly introduce module 2 assignment as well. So any questions, anyone? Anyone has any questions about supply chain costing? Yeah,
Good evening,
Ahmed.
Sanjay.
Good evening.
Yeah, mine is just, it's not a question, it's just an additional comment,
Mm-hmm.
especially as regards to supply chain revolution in Kaduna State, because I
Mm-hmm.
was partially part of the movement with Ramatu.
Mm-hmm.
Uh, yes, I think there's one thing that we're lacking basically in our state. Let me say, government support and autonomy. Yes, if you have DMA in your state and you get support from the government to do what you think is the best and you are being supported, I think a lot is going to be achieved. But because of political environment and let me say politics being played in our state, a lot of things that are supposed to be done are not done. Not that
Mm.
because we lack people that have the capacity, but people lack we lack the environment. Let me say there is no environment for you to perform. But Ramatu had that privilege to do what she was able to do. I think in Kaduna State they had an e-procurement platform. Most of the procurement done in a DMA is electronic or
Yeah.
all.
Yeah.
So I think that's it. I don't know any state that does that, maybe apart from Lagos. And also, during Ramatu's tenure as the ES of DMA, I think she
Mm.
supported the state in bringing on board a Zipline. Zipline is a medical drone delivery company. She did that. So
Mm.
I think a lot of things are happening. I think other states need to also copy same and also bring change to their DMA. I think which is very possible based on what you said. So from what you said, I've taken an insight. I'm currently in Bauchi, so I think I should
Mm.
meet the DMA hopefully next week and maybe try to sell the idea to them. I think something can be done
Mm.
anywhere we find ourselves.
Yeah.
Thank you very
Yeah.
much.
Absolutely. Thank you so much, Ahmed, and thank you for talking about Kaduna as well. Um, I supported that program for about 6 months in different capacities. I also went to Abuja and we had the officials from DMA and LMCUs and other Ministry of Health profession officials from Kaduna, Gombe, and one more state. So I also did a training there. I know willingness in professionals is there, that there is no doubt about it. I know sometimes the political climate can be challenging in Nigeria, and not just at a federal level, but also at a state level. Sometimes governors of a state, they have a different vision. Sometimes, you know, they may not have supply chain as a priority. But I think in all the states where DMAs have been established, I think that's a great start. And DMAs and LMCUs both, functional DMAs and functional LMCUs. Let me say it like this, because I know in all the states in Nigeria, at least DMA is there on paper. It's not functional. So let me say functional DMAs and functional LMCUs. So all the states who have that, that's a great start. Now the question is, how can they adopt best practices in supply chain? That is the next thing. Now, whether it is a Bauchi state or, I mean, there are multiple states in Nigeria as well. So everyone has to come to a standardized understanding of how supply chains needs to be managed, and that is where programs like this are beneficial, because we are taking you through the best practices in supply chain, even if not going deep into each one of them. At least that gives you an idea that what are the things that needs to be done. Yeah, Ahmed is saying Plateau Jos launched their DMA last week. So yeah, exactly. So on paper, like I said, DMA should be there, but not everyone is functional. So wherever DMAs are getting functional, getting launched, that's great start. but now it has to be translated into actual logical supply chain actions. And that is what all of you are here for. You should be the advocate, to do the right things in supply chain. Whatever is possible is good. Everything will always not happen, but whatever happens would be beneficial for the system. Okay, so think it like this. Okay, so anyone else who has any question or a comment, happy to respond to that as well. Okay, so no other comment. Let me first quickly do, let me tell you about the module 2 assignment, and then we will know how much time we have, and then we will come to the discussion. So in module 2 assignment, if you have not attempted it yet, what you need to do is you need to create a methodology. It can be theoretical, it is fine. But once you create a methodology to uh, undertake supply chain costing program, you will get a better idea how it is done. What you need to do is you need to read the documents which are provided to you. There is a supply chain costing plan from USAID provided to you, one document. Then the Kaduna supply chain costing study has been provided to you. So review those documents and then think from the perspective of your own state or organization for that matter. You are only required to develop a methodology of how you would do this study. You don't need to add data. You don't need to add any real stuff. You can take assumptions, you can create hypothetical scenarios. But even if you do that, you will get a much better understanding of how supply chain costing studies should be done and what are some of the key performance indicators when you're talking about costing supply chain costs. So what are the key indicators? So this is your module 2 assignment. This will help you understand the implications of it. This will help you understand the process of it. So do it well, and this will help you gain practical competencies on this side. So if in future supply chain costing study is happening in your state, you can say you have the skills and go participate in it. Okay, so that's about the assignment. Now, I hope you are willing uh, to contribute. There's a quick discussion that we can do. We can discuss these 4 questions or part of these questions, that what kind of costs should be considered, at what supply chain level should the costs be considered, how would you categorize these costs, various costs which can be, which come under supply chain, how would you categorize them, and what do you think contributes the highest in the overall cost of delivering product to a facility? So anyone who wants to contribute, you can take one question and write and tell us a response. Muskan, what you can do is you can stop this slideshow and then write some responses directly on the screen when someone is speaking.
Sure.
Okay, so anyone, please, you want to take any question and then tell us a response, and Muskan will write in that appropriate box.
Hello.
Yeah, Isaac. Yes, go on.
Okay, so the first question is, sorry, what
Muskan, you
cost
have to.
should be?
Yeah,
Not say
that's
this.
correct. Yes, please go on.
What cost should be considered?
Mm-hmm.
Okay, so there are several costs that need to be considered, and
Yes,
I
such as.
mentioned just one. The cost of transportation, logistics from the manufacturer to the country where the product is being ordered. That's one. The second one is the cost when the product have arrived in the country to the end user, the service point delivery, where the drug gets to the end user. Those
Okay.
are two.
So cost number, sorry,
Then
1 second. Sorry, Isaac, 1 second. So cost number one, Muskan, is transportation logistics from manufacturer to country. Number two is from the, let's say, the country port to the patient or the health facility. Yes, Isaac.
the drug also stop at the warehouse. So warehousing costs.
Yeah. Warehousing cost. Correct.
I'll stop there. Those are the ones I think.
All right. All right. Good.
Okay.
Good.
Finally, you now among the costs, the people, the personnel who does forecasting, procurement, and all those circle, it also comes at a cost. They don't do it free. So it to be
Human
built
resource
into
cost.
costs
Yep.
of
Okay. All right.
product coming in. I'll stop
Yeah.
there. What
Okay.
else we add?
All right. Anyone else who would like to add on to the costs that we should consider when we are doing a supply chain costing study? There are some other costs which Isaac has missed. Anyone else? Yes, Evan.
Is procurement cost part of this procurement?
Procurement cost is the cost of the product itself. So that we already know. Anything that is not the cost of the product. Or do you mean the procurement cost as in management of procurement?
Yes, management.
Okay, so say procurement operation cost.
Yes.
Muskan, write procurement operation cost. Yeah.
Yes. Then I don't know. I don't know how you classify this, but let me say it. I was privileged to manage a warehouse. We use this inventory software, M Supply. So you know you have to pay for the services. Yes, I don't know. Yes, yeah.
Yeah.
So this
Technological
software, that
resources
platform.
cost. Yeah,
Yes.
absolutely.
Yeah. Thank you.
Absolutely. Anything else that you think we are forgetting? Anyone?
Sanjay, may I?
You can go ahead as well.
Just from what I learned from you today in this lecture, storage costs is something I think we're forgetting.
Yeah, so that's warehousing.
Yeah.
Yeah, so you can write warehousing slash storage. The third one.
So Sanjay, I don't know where you add this. I don't know if it's part of supply chain. I don't know. Sometimes when you procure commodity, you have to do quality assurance. You take it to the lab. I don't know. You have to sample and make sure the quality of products. Then before it
Absolutely.
moves to the customers. I don't know.
Quality assurance cost. No, absolutely right. Absolutely right. Quality assurance cost. I would say I think most of it is done. There's just one cost, I would say. I mean, yeah, one type of cost which no one has said. Anyone would want to see what is left, more or less? I mean, there can be some micro costs as well, depending on country to country, but more or less, this is mostly it. Okay, so one cost is your all types of compliance cost, such as custom clearance, such as in some cases taxes, in some cases regulations, regulatory costs. So all those are compliance costs and insurance, for example. So you would also sometimes you do insurance of products when they're coming from one place to the other. These are all compliance costs. Okay. So now these are the kind of costs that should be considered. Now the question is, what are the various levels at which these costs should be considered? Let's talk from perspective of Nigeria, of course. I mean, this is a simple one actually, if you think about it. And all of you who have done CLC1, you remember your initial assignment, supply chain diagrams. Over there as well, you created levels. So all the levels you created should be considered. So what were those levels? Anyone?
Hello.
Yeah, Isaac. Yeah, Isaac, go ahead. Isaac or Ahmed, I think one of you started to speak. Go ahead.
Okay, I don't know. If I can remember, is it the upstreams and the downstreams?
No, no, no. I'm talking about the levels, different
Hello.
levels of supply chain. Yes, Isaac. Isaac, you keep muting yourself. If you unmute
Sorry.
yourself,
Okay. Can you hear me now? Can you hear me now?
yes.
All right. So there are three levels: the federal,
Mhm.
state, and local government levels. So those are
Uh,
the three
is
three
there
three
anything?
tiers.
Is there anything between state and LGA?
Yes, state, state. I mean federal, state, and local government.
Yeah. So what I'm asking is there anything between state and local government, or is it state and local government?
No,
Just
there
curious
is a
because
there is
in some states there might be. No.
yeah. Okay, for some of for these DMA things now, the states over a
So state is the DMA. So state
state is
level
a
is the
DMA.
DMA. So
Yes, but
from
then there's
DMA, do
also
we directly go to LGA, or is there something in between? That's what I'm trying to
there
ask.
is a link. There is a link between the state and
Yeah.
because there is a state
What
and
is
there's a
that link?
local government part of it.
Okay, let's
So
just say
there's a
local government. Let's leave it there. Let's leave it at that. Local government. Maybe what we can say is after local government can be your actual facility, no?
yes, that's correct. That's correct.
Yeah. Okay. So let's do it like this. Everyone agrees. Anyone who has a different understanding of the levels? Is there anyone who has a different understanding of the levels? So now, just so that I understand, at each level, some costs would be applicable and some costs may not be applicable. Okay.
Yeah.
So now for each level, you have to understand which costs are applicable, identify them, cost them. Then once you're done with all the level, then you have to combine it. Now the third question is categorization of various costs. Now again, this is a simple one. Festus, yes, you have raised your hand. Go on.
Yes, I want to say that from the day made, we're talking about the level. Some states
Okay.
have decentralized warehouses
Mm-hmm.
for
Mm-hmm.
proximity states, and at those levels, they are not within the state, but they are maybe like a senatorial zones, regional zones, that where there are warehouses that brings
Yes, yes.
close to.
That's
At
what
that
I
level,
was
I
trying
think
to figure out.
okay,
Yes,
okay,
yes, yes. So
thank you.
Muskan, so you see in Nigeria there are some states where between the DMA and the local government there can be some regional warehouses. So it is not applicable for all states, but there are some states, just like Festus mentioned. And I have heard about them, but again I don't know which states have them because ideally there should not be any regional warehouse. Once a DMA is there, I don't think there is a need of regional warehouses unless a state is really, really big. If there is a very large state, then probably, otherwise no. So then if there is a regional warehouse, then they are also a level. Okay. So now the next part is categorizing those costs. So now again, it becomes very simple. Once you've understood what those various costs are, can someone take a crack? What how could you categorize the costs which are written in the first question? How would you
Hello.
categorize them? Yes, Isaac. So you can unmute yourself. And please, anyone who wants to please contribute. I know Isaac, Ahmed, Festus, they contribute more, but that does not mean that you can't. So please, you can unmute yourself, raise your hands, and I will give you enough time to contribute. But Isaac, over to you.
Yes, yeah. When Festus raised the issue of the senatorial, the states being grouped into senatorial, every state in the country has 3 senatorial districts, and so the DMA, the central medical store, is the one coordinating everything. But you know, some places are very, very far from the state central. So there is need for these stores at this senatorial district. Maybe 6 local government goes to maybe Plateau South or Plateau North or Plateau Central. So there are there are supposed to be other warehouses, and so that everybody doesn't have to come to the center, to the state capital,
Absolutely.
to access their medication, because also that will also increase the cost at which these people will get their own. So those senatorial
Yeah. No, I understand, Isaac, that
warehouses are also very, very important. Thank
absolutely.
you.
No, they are important if there is an issue of distance. Um, but again, if you remember from CLC1, there is a concept called outsourcing. So there is a possibility that you outsource a transportation in a way that you do not need those warehousing costs. But again, that's a debate. Let's not go into a debate. Today, we are trying to understand the levels. So yes, those regional or district warehouses should be considered wherever they are. Okay. But now let's discuss how would you categorize some of these costs. So anyone who would want to contribute about categorization. Some of it is already done in question 1. So someone just has to club them together because some of them are similar kind of costs. Anyone? Isaac, yes, go on. Okay. Isaac, are you speaking?
Hello?
Yeah.
Okay,
Yeah,
yes.
go on.
One of the costs, I will just mention one, others will talk. Logistics cost, both in country and from the point of manufacture to the in country, and from the port to
Hmm.
the warehouse and to the service
Hmm.
delivery. So all that is one logistic cost, altogether
Uh,
logistic.
if you call them logistics, then warehousing should be part of it as well.
Yes, and warehousing. Yes, that's true, sir. I agree.
Yeah. So logistics cost is one category. Then Festus has written management costs. That's another category. So Festus, what is included in management? Can you explain?
Okay. The management will talk about the personnel, the people that work around it, the operation cost. All these are supposed to be management costs, human resource costs.
Ideally, the technological cost can be over there, or you can call it a management and administrative, so that human
Yes.
resources comes into there, technology comes into there.
Yes.
You can also add compliance and quality assurance in there as well. But depending on how you categorize, I mean, it can be another category as well. Um, yeah, and then I think then what is left is some of the very specific operations cost, in this case, which is procurement operations cost. And then if uh, we want to categorize in operational level, then quality assurance can also be an operation. So then procurement and quality assurance can come under operations cost. You can categorize under operations. And then I mean, you can look at the Kaduna case study. I mean, they have categorized it into 4. They had their own objectives and the way they did it. So they did not call it logistics. They called it storage and transport. But you can combine them as well. It's totally your call. So again, all supply chain costs can be categorized into 3, 4, at the max 5 heads. Okay. So once you understand those heads, then it becomes easier. Okay. Now, out of these categories that you have created, what do you think contributes the highest?
I think logistics. Logistics.
Yeah. In a large supply chain, logistics would be the highest cost. Logistics and management would be your two most highest contributing costs, because you need a lot of people to manage supply chain. That is a high cost. And then since Nigeria, country like Nigeria, you import. That's why your logistics costs are higher. If Nigeria has local production and you procure from local manufacturers, your logistics cost will go down drastically. Because then, if you procure from local manufacturers, you also don't need to store for a very long time. You can store for less. The manufacturer can send to the right location whenever you want it. It's called vendor managed inventory. So if you have local manufacturers, you can do something called vendor managed inventory, and you can go and read about it. But unfortunately, today, most Nigerian organizations can't do it because most of the products you import, you do not have local manufacturers for it. And that's why your logistics costs are very high. Okay. So you see, within 10 minutes, we did half of your methodology. So this is your methodology, your assignment. We did that in 10 minutes. Now you need to go and decide how will you collect this data, who will you contact, what kind of questionnaires, how will you plan your travel, how will you analyze it. So that is your methodology, and that is your module 2 assignment. So that was today's session. There's nothing more for me to add. If you have any questions, you can add. Muskan will send a poll on WhatsApp for the feedback for today's session. But if you have any questions, please do ask them. Otherwise, from my side, I mean, the session is over. The next session is on supply chain data, and you would receive the invites as well. And we will have another instructor in the next session as well. So if there are no other questions, then we will close the session in a couple of minutes. Excellent. So, I mean, I'm not seeing any questions. So I hope